Question number 281. Which task should be assigned to the nursing assistant to keep which of the following at the bedside? So option A, at a tracheostomy set. Option B, a padded tongue blade. Option C, an endotracheal tube. And option D, an airway. So option A, a tracheostomy set is correct answer. Question number 282. Which task should be assigned to the nursing assistant? Option A, placing the client in circulation. Option B, empty the Foley's catheter of the pre-eclamptic client. And option C, feeding the client with dementia. And option D, ambulating the client with the fractured hip. So option C, feeding the client with dementia is correct option. Question number 283. A patient is known to be strict vegetarian who consume no meat or dairy product. So which of the following vitamin deficiencies should the nurse expect in this patient? Option A, folic acid deficiency. Option B, riboflavin deficiency. Option C, vitamin K deficiency. And option D, vitamin B12 deficiency. So option D, vitamin B12 deficiency usually will seen in vegetarian patient. Question number 284. Which of the following thermometer accuracies is affected by eating, drinking and mouth breathing? So option A, glass. Option B, chemical. Option C, electronic. And option D, tympanic. So option A, glass is correct answer. Question number 285. Which of the following best describe the role of the charge nurse? So option A, promote a healthy lifestyle. Option B, promote the comfort of the patient. Option C, provide coordination of care to ensure continuity. And option D, possesses the highly skilled communication method. So option C, provide coordination of care to ensure the continuity of care is correct answer. Question number 286. The intensive care unit nurse manager plan to delegate a task to a nurse. So which is indicated for successful delegation? Option A, nurse manager supervises nurse. Option B, nurse has authority to change. And option C, nurse manager check task sometime. And option D, nurse manager asks another nurse to check task. So option A, nurse manager supervises nurse is indicate for a successful delegation. Question number 287. Nurse manager tells a nurse that her performance will be evaluated after 3 months. So what aspect is related to communication? So option A, feedback. Option B, delegation. Option C, assignment. And option D, debriefing. So option A, feedback is correct answer. Question number 288. Which of the following is newly promoted nurse manager first priority? Option A, check all nursing care documents are correct. Option B, supervise the direct nursing care to all of the patient. Option C, complete evaluation of all new nurses. And option D, develop the unit clinical operation plan. So option D, develop a unit clinical operation plan is correct answer. Question number 289. The nurse manager prepare unit clinical operational plan. So what is the top priority in the plan? So option A, infection control. Option B, staff orientation. Option C, quality project. And option D, safe patient care. So option D, safe patient care is a top priority in her plan. Question number 290. Nurse manager is open-minded, listen to the team, understand other and make changes to improve the unit operation and procedure. So what type of leadership style is this? So option A, situational. Option B, democratic. Option C, compensate. And option D, transformational. So option D, transformational is correct answer because the style where the leader inspire, motivate and empower the employee to achieve the extraordinary outcome for long-term organizational success. Question number 291. A nurse is showing stress and anxiety due to the long duty hours. So which of the following should the nurse manager do here? So option A, give day off. Option B, give light task. Option C, offer vacation. And option D, talk about coping. So option D, talk about coping is correct answer. Question number 292. A nurse manager includes staff in decision making process. So what unit structure is used here? Option A, divisional. Option B, centralized. Option C, functional. And option D, decentralized. So option D, decentralized is correct answer because it can distribute the decision making authority throughout an organization, empowering the team and individual to task, ownership, innovate and act swiftly. Question number 293. What is the characteristic of democratic leadership style? Option A, more changes. Option B, structured work. Option C, staff participation. And option D, no leader decision. So option C, staff participation is correct answer, because democratic leadership style is a collaborative style where the leader involves the team member in decision making, encouraging the input, creativity with open communication. Question number 294. Which of the following is most important when developing a focused clinical question for evidence-based practice research? Option A, lineage. Option B, finance. Option C, population. And option D, technology. So option C, population is correct answer, because evidence-based practice research questions are structured inquiry often use the PICOT frame. P means population, I means intervention, C means comparison, O means outcome, T means time. So to guide the clinical decision, improve the care and narrow searches to specific evidence-based answers. Question number 295. Which of the following is the most appropriate action for nurse manager starting a new hospital? Option A, observe the staff while keeping presence and role unknown. Option B, plan and coordinate new strategy with top level management. Option C, introduce self and observe unit activity for at least 3 months. And option D, meet with each staff member separately about needed unit changes. So option C, introduce the self and observe unit activity for at least 3 months is correct answer. Question number 296. A nurse unit to conduct a research project. So what is the most important step to be identified here? So option A, research problem. Option B, research setting. Option C, analysis plan. And option D, sample size. So option A, research problem is correct answer. Question number 297. Which type of study design provide the strongest evidence? Option A, qualitative study. Option B, randomized control trial. Option C, systemic review of descriptive study. And option D, systemic review of correlational study. So option B, randomized control trial is correct answer, because randomized control trial is a rigorous prospective experimental study design that randomly assign the participant into at least 2 groups, an intervention group and control group, to compare the outcome and determine the cause and effect relationship. Question number 298. A nurse researcher wrote in her explanatory statement, the researcher will only use a questionnaire to measure the nursing job satisfaction. So which ethic principle is the researcher addressing here? Option A, justice. Option B, beneficence. Option C, confidentiality. And option D, non-malfeasance. So option C, confidentiality is correct answer. Question number 299. The nurse want to conduct the unit research on patient fall. So which of the following is the first action to take? Option A, review the research literature. Option B, select the research design. Option C, review the patient data. And option D, interview the patient. So first action will be review the research literature. So option A is correct answer. Question number 300. Research data to be collected from children on nursing unit. So what type of consent is most appropriate here? So option A, informed written consent. Option B, consent signed by the parents. And option C, consent from the physician. So option D, hospital administration consent. So option B, consent from signed by the parents is correct answer.